think this conference is a brilliant example. We find out that the problems are common. We have very common problems, but we have very different countries with very different cultures, very different wards.
Well, I think accountability for health equity, to me, as someone who's working in the international NGO space, means social equity. It means social justice. It means making sure that people, our populations that we serve, in the communities in which we serve them, have accessible, evidence-based health care.
Accountability for health equity means that people, ordinary people, especially those from marginalized communities, need to come to the center of the health system, and which means two things. One, that people have to start speaking up, they have to demanding their health rights, and secondly, that the health system has to start responding to people's health needs in a very systematic way.
There are so many partners globally working in these areas. Is how we can come together to share experience.
We need to put together different models of best practices, what have worked in different contexts, to be able to make the emerging practitioners in the areas that we're coming from to have faith in this approach.
I think a good way to learn with each other is to share and exchange mistakes.
I think a key thing is understanding that social norms are a key part of accountability. Often we think of accountability as we think of the tools, community scorecards, or we think of the laws that we're seeking to be enforced, or the rules and regulations. But particularly when we look at health inequalities, it's often the social norms that hold people back.
Do we understand enough what existing accountability practices are already in place? So I think we could improve our understanding of how accountability moves in local contexts.
I would prioritize the issue of ensuring that there are champions at a local level and at a national level who can speak out about the inequities that exist.
Well, as a priorities, I would say that the first one is to think about the complexity and the structural determinants of health inequity. So very clearly we need to work beyond the healthcare system. We have to work with the judiciary system, with parliament, and all the other checks and balances within the state that has to do with these structures.